Hello everyone, my name is Joanna Purdy and I'm a Public Health Development Officer with the Institute of Public Health, and I will be delivering this teaching session on health impact assessment. Before I commence, I would like to tell you a little bit about the Institute of Public Health. The overall aim of the Institute is to inform public policy to support healthier populations in Ireland and Northern Ireland. The Institute was established in 1998 and is jointly funded by the Departments of Health in Ireland and Northern Ireland. Our key priorities are promoting health and well-being, improving health equity and reducing health inequalities. And as you will see today, health impact assessment is one way in which we seek to achieve these priorities. We also work to achieve these priorities through evidence, policy and partnership. In terms of evidence, we do this by conducting secondary analysis of existing data and synthesizing evidence to produce evidence reviews. In terms of policy, we are actively involved in government policy and strategy implementation committees, as well as responding to public consultations and providing oral and written evidence to government committees who are developing legislation. In terms of partnership working, we work with partners from academia, the community and voluntary sector, statutory agencies, and government departments to improve health equity and reduce health inequalities. Today's presentation will comprise 3 parts. Part 1 will include a brief overview of health in all policies, the determinants of health, health inequalities, and an introduction to health impact assessment. And we'll do this through our digital learning module, which includes the 7 stages of health impact assessment. This first presentation will also make reference to other impact assessments, as well as the United Nations Sustainable Development Goals. In Part 2, I'll provide detail on the screening and scoping stages of health impact assessment, and in Part 3 we'll cover the analysis, reporting, implementation, monitoring and evaluation. On the 6th of October, I will deliver an interactive workshop, and during this time you'll have an opportunity to work through a case study and apply some of the stages of health impact assessment. At that workshop, I'll also provide you with real-life examples of both strategic and project level health impact assessments. I'm going to commence by introducing you to the concept of health in all policies. Health in all policies has been described by the World Health Organization as an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies and avoids harmful health impacts in order to improve population health and health equity. It improves accountability of policymakers for health impacts at all levels of policy making. It includes an emphasis on the consequences of public policies on health systems, determinants of health and well-being. Health in all policies is about promoting healthy public policy. It's a way of working across government to encourage all sectors to consider the health impacts of their policies and practices. Health in all policies is based on the understanding that health is not merely a product of health sector activities, but to a large extent is determined by living conditions and other societal and economic factors, and therefore often best placed or best influenced by policies and actions beyond the health sector. The ultimate aim of health in all policies is to improve evidence-based policy making. The South Australian Government has adopted this approach to meet the specific needs of their population, and more specifically to address targets within South Australia's strategic plan. So what is health in all policies about? It's about improving population health, health equity, and the context in which health systems function through public policy across sectors. Healthy Ireland and Making Life Better, the public health frameworks for Ireland and Northern Ireland respectively, place a high priority on improving health and on tackling the wider determinants of health. All policies can have positive and negative impacts on health, and there's a strong body of evidence to support the fact that the impacts of health determinants are not equally distributed within the population. Efforts to improve health require sustainable mechanisms that support government agencies to work together. Health in all policies is about improving accountability of policymakers for health impacts at all levels of policy making. It includes a strong foundation on human rights and social justice, and the indicators of success will be long-term equality. So how does health impact assessment relate to health in all policies? According to John Kem, a health impact assessment practitioner, health impact assessment supports a health in all policies approach by describing the consequences of policy options on health, helping to improve decision making, recommending how positive impacts can be maximised and negative ones minimised, and by shaping the policy making environment to inform future policy making. In the next few slides, I'm going to talk about the social determinants of health. That is, those factors or influences outside of the health sector that influence our health and shape health outcomes. Social determinants of health contribute to health inequalities between social groups. This is because the effects of social determinants of health are not equally or fairly distributed across society. Social determinants can influence health both directly and indirectly. For example, damp housing can contribute directly to respiratory conditions, while educational disadvantage can limit access to employment, increasing the risk of poverty and its adverse impact on health. Social determinants of health are interconnected. For example, poverty is linked to poor housing, access to services or poor diet, all of which are in turn linked to health. I'm sure you're all very familiar with this diagram by Dahlgren and Whitehead 1991, which outlines the layers of influence on health. Dahlgren and Whitehead describe a social, ecological theory to health. They attempt to map the relationship between the individual, their environment, and disease. Individuals are at the centre with a set of fixed genes such as age, sex, and constitutional factors. Surrounding them are influences on health that can be modified. The first layer is personal behaviour and ways of living that can promote or damage health, such as diet, smoking, alcohol consumption, and physical activity. The next layer is social and community influences, which provide mutual support for members of the community in unfavourable conditions. But they can also provide no support or have a negative effect, such as antisocial behaviour or crime. The third layer includes structural factors, that is, housing, working conditions, access to services, and provision of essential facilities. The fourth layer considers the general socio-economic conditions, cultural and environmental conditions. Moving on then to talk a little bit more about the main determinants of health in a local context. These figures illustrate the main determinants of health as shown in Making Life Better and Healthy Ireland, the public health frameworks I alluded to just a moment ago. Both figures show how individual and community health is determined by behavioural choices, by social, environmental and economic conditions, and by access to high quality healthcare services. Policies and actions formulated outside the healthcare sector have a significant impact on people's health and well-being. For example, a housing sector scheme on damp proofing will contribute to improving respiratory health, and spatial planning and transport sector policies that increase active travel will in turn improve physical activity and ultimately better cardiovascular and mental health and well-being. In the next couple of slides, I would like to talk a little bit more about health inequalities. Sir Michael Marmot, who's a name I'm sure known to you all, Professor of Epidemiology at University College London and Director of the UCL Institute of Health Equity, defines health inequalities as follows. Sir Marmot says, the effects on health of social processes in general follow the social gradient. The lower the socioeconomic position, the more health is affected by the social determinants of health. For example, those with lower levels of education are more likely to be in low-paid employment and living in poor quality housing, and therefore at increased risk of poor health outcomes. The term health inequalities is used to refer to the avoidable gap in health outcomes between those at the top and bottom end of the social class or socio-economic classification scale. This illustration shows the gaps in life expectancy for men and women living in the most and least deprived areas of Ireland and Northern Ireland. People in higher socioeconomic groups are more likely to live longer and enjoy more years of good health than those in lower socioeconomic groups. There are also notable differences in the health experiences of men and women. In Northern Ireland, we can see that men in the most deprived areas can expect to live on average 7.1 years less than men in the least deprived areas. That's a difference of 74.6 years for those in the most deprived areas versus 81.7 years for those in the least deprived. Whilst for women, the life expectancy gap is 4.4 years, with women in the least deprived areas living 84.1 years compared with those in the most deprived living 79.7 years. In Ireland, the life expectancy gap between the most and least deprived areas is 5 years for men, and for women the gap is 4.5 years. We see that women in Ireland in the least deprived areas can expect to live until they're almost 88, compared with those in the most deprived areas living to just over 83 years. I'm now going to move on and give you a brief introduction to health impact assessment in the context of the work that the Institute of Public Health has been doing. In November 2021, the Institute of Public Health published its updated health impact assessment guidance. The guidance draws on best practice in impact assessment from across the island of Ireland, the UK and internationally. Within the guidance, there are new tools for each stage of the health impact assessment process. It's a user-friendly and practical framework to guide policymakers, commissioners and practitioners when undertaking either standalone health impact assessment or health and environmental assessments. The guidance comprises 5 documents: a manual, technical guidance, a plain language summary, executive summary, and in addition we have also produced a document entitled The Case for HIA, which complements the core guidance documents. These are interactive, user-friendly documents which allow the reader to move from one section in the manual to another section in the technical guidance for more detailed information on a particular aspect of the HIA process. The manual sets out the policy context for health impact assessment in Ireland and Northern Ireland. It provides a practical framework for assessment of health as a standalone HIA or within environmental assessment. The manual explores in detail inequalities in health and health equity, as well as providing an overview of the HIA process. The technical guidance, as the name suggests, provides the technical detail for undertaking health impact assessment. And this comprises 6 parts which broadly reflect the main stages of the HIA process, and I'll talk about these in a little bit more detail later. The technical guidance includes practical tools and materials which are ready to use in real-world situations. The executive summary answers the following questions. What is health impact assessment? Who is the guidance for? What does the guidance cover? And what's the interface with other impact assessments? And this might be a good place to start for you when you're looking at the documents. Have a look at the executive summary and the plain language summary in the first instance to get a flavour for health impact assessment if you're not familiar with it. The plain language summary is a short summary of HIA accessible to a wide readership. And as I mentioned at the start of this slide, we have also produced a document entitled The Case for HIA. This document sits outside the main guidance, but it seeks to promote the use of health impact assessment, and it outlines the future directions for HIA across the island of Ireland. The documents are all available at the web link on the slide here, and they're all free to download. So what is health impact assessment? In the guidance, we have used the definition provided by the International Association for Impact Assessment. It defines HIA as a process which systematically judges the potential and sometimes unintended effects of a project, programme, plan, policy or strategy on the health of a population, and most importantly, the distribution of those effects within the population. And that's what we'll focus on in terms of health impact assessment, how certain vulnerable groups within the population or within society can be or may be unequally affected by a particular policy or proposal. Health impact assessment identifies appropriate actions to mitigate health risks and promote health opportunities. It guides the establishment of a framework for monitoring and evaluating changes in health as part of sustainable development. So who is the guidance for? This guidance is for organisations that are developing legislation, plans, policies or programmes. It can also be used by planning authorities and developers who are considering whether to grant or who are seeking permission for an individual project. The guidance can be used at different levels of government and decision making, such as ministerial committees, official groups, project boards, local partnerships, authorising bodies, councils and government departments. It's also for practitioners who are delivering health impact assessment, including standalone HIA, as well as health within environmental assessment. The guidance is presented in 4 parts. Each document is aimed at a different readership and has a different degree of complexity and technical detail. Just to mention briefly the intended audiences for each of the guidance documents that we talked about in the previous slide. The plain language summary has been developed for the general public. The executive summary is aimed at officials and leaders in all sectors whose decisions can directly or indirectly influence the health of populations. The manual is for those who are commissioning, inviting tenders for, or procuring the delivery of health impact assessment. And the technical guidance has 2 primary audiences: practitioners undertaking standalone HIA or health in environmental assessments, and stakeholders who are health stakeholders who are likely to have an interest or involvement in HIA, for example, public health teams. Let's move on now to think about the aims of health impact assessment, and these are described over the next 2 slides. HIA seeks to inform and enhance the decision-making process in favour of health and health equity. It aims to ensure potential positive health impacts and prevent potential negative health impacts of a proposal. HIA can contribute to improved health by firstly raising awareness among decision makers of the relationship between health and the physical, social and economic environments. Secondly, demonstrating how a proposal may affect the health of a population. And thirdly, by providing recommendations or measures on how a proposal could be modified to increase opportunities for health gain and reduce the chances of health loss. The second slide then on the aims of HIA. HIA contributes to better decision making by following a clear and transparent process, and we'll see that as we take you through the guidance and the templates and the structures that are in place for developing a narrative and recording those decisions and activities of HIA, ensuring that the conclusions and recommendations are evidence-based, and this is a really important, a core part of health impact assessment, and we'll see how that's achieved through gathering and collating data and evidence on the population of interest, and by helping those affected by the proposal to participate. Again, this is one of the unique aspects of health impact assessment. There's a strong community participation element that allows the community voice to be heard in terms of the health impacts of any potential proposal. In this next slide, I want to talk about the governance arrangements for health impact assessment. It's good practice for relevant health authorities, such as public health teams, to be involved from an early stage in the health impact assessment. It may be appropriate, but it's also good practice to convene a health impact assessment steering group for standalone HIAs. Governance arrangements for the health impact assessment are agreed at the scoping stage, and within the technical guidance on page 102, we have a table 3, which provides a terms of reference for HIA, and this helps to frame the governance issues and establish the methods that are to be used within the health impact assessment. Now, the terms of reference can include various things, and they can include the aims, the boundaries of the HIA, for example, that might be the geographical or the population scope. It'll also include the timescales of the health impact assessment. It'll highlight the stakeholders and key informants that are likely to be involved. There's also an opportunity to comment on any conflicts of interest that might exist and how those could be managed, as well as things like the non-negotiable aspects of the proposal. For example, planning regulations, where there are limits to what changes can actually be made. The terms of reference will also refer to the steering group membership, what their role is and any limits on their remit, the methods for gathering and presenting evidence, as well as the monitoring and evaluation and the resourcing for the HIA. Typically, a steering group will not be convened for health in environmental assessments, that is, within environmental impact assessment and strategic environmental assessment, as the governance and consultation processes are already set out within their governing statutes and directives. Health impact assessment is a systematic approach that can be applied in different contexts and sectors. This guidance is designed for standalone health impact assessments and the assessment of health within environmental assessment. The focus of this teaching session is primarily HIA, but I will refer to environmental assessment occasionally. Environmental assessment, which in most cases is a statutory process, is required to consider human health. Environmental assessment is an umbrella term for strategic environmental assessment and an environmental impact assessment. The guidance refers to standalone HIA and health in environmental assessment. These forms of assessment are applied at what we describe as a strategic level, that is, to policies, legislation, plans and programs, and also at a project level, i.e. to individual projects. The guidance steers the user through the strategic and the project level HIA. As I've just said, health impact assessment can be conducted at different levels, that is, strategic and project level. At strategic level, a strategic level HIA applies to a policy, plan, programme or a piece of legislation. Strategic level HIA tends to involve simpler but arguably more powerful tools for use by those with more generalist health knowledge to influence the broad structural changes in a positive way. HIAs are also conducted at a project level. For example, a specific housing development or reconfiguration of community health services in a new location. Project level HIAs tend to involve detailed consideration of local data and more involved analysis by health specialists. This chart shows the different paths a health impact assessment can take, as well as the unifying features across all forms of HIA. I appreciate this may be a little bit difficult to see in the slide, but obviously it's presented within the manual and technical guidance, so you can look in those documents for a better image of this illustration, of this flow chart as I'm talking through the slide. Although the methods used and the scope of the issues examined will vary, the guiding principles, the process and the approach remain the same. As we can see from this chart, HIA can be voluntary, but it can also be required by policy. At present, there is no mandatory requirement to undertake health impact assessment in Ireland or Northern Ireland. However, the Public Health Wales Bill in 2016, passed by the Welsh Synod, included within it the requirement for HIAs to become a statutory process for public bodies in Wales. Environmental assessment, which in most cases is a statutory process, is required to consider human health. As I mentioned a few moments ago, environmental assessment is an umbrella term for strategic environmental assessment and environmental impact assessment. Both standalone HIA and health and environmental assessment are applied at the strategic level to legislation, policies, plans and programmes, and at the project level to individual projects. You will see this diagram again in the online learning module, which you will complete as part of this teaching session. It's essential that HIA encompasses a broad understanding of health and its determinants. Health within HIA covers physical, mental and social well-being. This demands a focus on the social, economic, environmental and institutional determinants of health. This is essential in helping to decide where, when and what type of HIA might be appropriate and whether specialist assistance is required. Most opportunities to improve population health are outside the direct control of the health sector. Therefore, intersectoral work between public health and other public, private and voluntary sector organisations is fundamental to delivering national and international health policy, including Healthy Ireland and Making Life Better. As highlighted at the start of this presentation, HIA can facilitate the Health in All Policies approach to deliver population and community health benefits. Ireland's Department of Health has recognised the need for HIA training for those in public health and environmental and planning roles. We want to move on now and talk a little bit about the different types of HIA. HIA can have varying breadths and scope and depths of analysis. It's good practice to conduct what we describe as a proportionate HIA, taking account of the time available, the resources, the proposal complexity, the compliance requirements, for example, a statutory defined procedure and/or output. The technical guidance provides tools to allow for quick preliminary conclusions or for a deeper understanding with more nuanced, evidence-based, reasoned conclusions. I would like to mention very briefly the parallels between HIA and other impact assessments. Health can be integrated into other assessments, and in doing so, the assessor can draw on the approaches and tools discussed in this guidance, particularly scoping. However, these other assessments do not typically report against population health outcomes. Let's look firstly at environmental assessment. Strategic environmental assessment and environmental impact assessment directives require a consideration and protection of human health. The HIA guidance recommends a broad consideration of health rather than simply a narrow biophysical view of health. Whilst there is no legal requirement to undertake a poverty impact assessment, good practice should include an integrated assessment of human health from a poverty outcome perspective. Human rights can align with or relate to the determinants of health that can be considered within HIA, and a standalone health impact assessment may inform a statutory human rights impact assessment. Public bodies in Ireland and Northern Ireland are required to carry out an equality impact assessment. The 9 equality categories of an EQIA may overlap with the vulnerable groups considered when carrying out a health impact assessment, but HIA will not necessarily consider all 9 equality categories and may consider other vulnerable groups, for example, in relation to income, social disadvantage, or social isolation. In terms of regulatory impact analysis, Ireland's revised RIA guidelines states that a health impact assessment is to be carried out on all new relevant government policies, and an RIA should therefore, where appropriate, examine the potential impact on health with particular reference to health inequalities. The UK government's guidance states that the protection of human health can be a legitimate policy objective. The RIA template requires an evidence base which includes reference to wider impacts in the context of other impact assessments and recommends HIA. Looking then at social impact assessment, the Government of Ireland has committed to incorporate poverty impact assessments as part of an integrated social impact assessment, with health impacts as a core feature of this new tool. The outcomes and populations considered by social impact assessment are a subset of the determinants of health and vulnerable groups considered within HIA. Social impact assessment therefore overlaps with health impact assessment, but does not explicitly relate findings to health outcomes. A social impact assessment could be undertaken as part of or used to inform a health impact assessment. The Sustainable Development Goals are the 17 goals of the 2030 Agenda for Sustainable Development adopted by all UN member states in 2015. The Sustainable Development Goals recognise that ending poverty and other deprivations must go hand in hand with strategies that improve health and education, reduce inequality, spur economic growth, tackle climate change and preserve ecosystems. Each of the Sustainable Development Goals is important for health, and they are all social, economic or environmental determinants of health. Goals 3 and Goal 10 are of direct relevance to this work. Goal 3 is about ensuring healthy lives and promoting well-being for all people at all ages, and Goal 10 is about reducing inequality within and among countries. The goals are not legally binding, but countries are expected to establish national frameworks for achieving them. The UK Government is delivering the goals by fully embedding them in the planned activity of each government department, and the Government of Ireland has published what is called the Sustainable Development Goals National Implementation Plan, providing a whole-of-government approach to sustainable development. The Sustainable Development Goals are an existing health and all policies framework for departmental leadership and interdepartmental cooperation, as well as involving local government and other stakeholders to achieve good health and well-being, i.e. Goal 3, and reduce inequalities, i.e. Goal 10, and that is across the island of Ireland. Health impact assessment is an approach recommended by the World Health Organization to achieve the Sustainable Development Goals. The World Health Organization states that public health can provide an overarching and unifying platform to achieve the Sustainable Development Goals. The goals are explicitly referred to in the Sustainability Principle for HIA, which is covered in the online digital learning module. This presentation has set the scene for health impact assessment. The next stage for you is to complete the digital learning module, which is available at the link below. This is an introduction to health impact assessment. It is essential that you complete this module before watching other parts of the lecture. The module is part of a wider learning pathway on health impact assessment and includes a blog and videos which you can view as part of the learning on health impact assessment. When you click on the link shown in this slide, you will need to create an account for the learning platform. This is very straightforward, and you can use the login details to access your progress on the learning module at any time. The module takes about 30 minutes to complete, and you will receive a certificate upon completion of the module. I would recommend that you have a look at the HIA guidance after you've completed the digital learning module. You may find it useful to have a look at the manual, which gives an overview of the HIA process, and I will cover more of the detail found in the technical guidance in the other parts of this presentation. If you have any difficulties accessing the module, please feel free to contact me. My details are on the next slide. Thank you for listening and for your attention, and if you need to get in touch, please feel free to email me at the contact email address below. Thank you.